Hey guys, welcome to my channel, My DMP Life. Today I wanted to talk about the pros and the cons of being a family nurse practitioner. So if you're interested in what are the pros and the cons of being a family nurse practitioner, then stay tuned. So today I want to talk about 5 pros and 5 cons of actually being a family nurse practitioner in my experience. So for those that don't know me, I'm a family nurse practitioner who practices full-time in internal medicine and PRN in urgent care. And I currently have a doctorate in nursing. So I would say the first pro of being a nurse practitioner is going from 12-hour shifts, being a bedside nurse, to going to 10-hour shifts and having an 8 to 6 schedule or 8 to 5 schedule or whatever your schedule is. But the schedule is a pro of being a family nurse practitioner. So I currently work 4 10-hour shifts, 8 to 6, 4 days a week. My off days are Thursdays and then the weekends. We don't work any holidays. I don't pull any extra shifts if I don't want to. I don't work over 40 hours if I don't want to. So the pro is actually being able to work your 40 hours. Another pro of actually being a family nurse practitioner is the income. Going from bedside nurse to family nurse practitioner, although my responsibility is greater, I've just about doubled my income. So that's definitely a pro for being a family nurse practitioner. Another pro would be the job demand of the family nurse practitioner. With so many people living longer and having more comorbidities, there's always a need for nurse practitioners in healthcare, especially with the decrease, or I wouldn't say decrease, but the number of physicians that are actually going into practice. And also it takes a longer amount of time to actually train a physician. With a limited amount of physicians practicing in primary care, just due to the long period of time that they actually spend training to become physicians versus a nurse practitioner. So the job demand will always be there for us. The fourth pro of being a family nurse practitioner is actually job satisfaction. So in 2008, nurse practitioners were rated number 4 as having the best jobs in the United States. And that could be a number of factors, including stability, autonomy, depending on where you're at, pay, depending on where you're at, and just overall job satisfaction with the new role that you're in. And the fifth pro of being a nurse practitioner is actually the practice setting. So as a family nurse practitioner, you have the opportunity to work in so many different settings. You can do family practice, you can do urgent care, you can do women's health, you can do pediatrics, because you've been trained to actually see from birth to death. So there's so many opportunities for you to work in. You can choose to work in a rural setting. You can choose to work in a city. You can choose to work in private practice. You can choose to work with a big organization. There's so many different areas that a family nurse practitioner, or any nurse practitioner for that matter, can actually practice in. So the first con of being a nurse practitioner is the pro of being a family nurse practitioner, and is the schedule. So I kind of miss working the 12-hour shifts, doing my 3 12-hour shifts and being done, versus working my 4 10-hour shifts and sometimes having to bring my charting home. So I would say that schedule is also a con of being a family nurse practitioner. So even though my schedule is 8 to 6 every day or 4 days a week, I still have to make sure that my charts are closed, make sure my charting is appropriate. So that takes a little bit time. And in my experience, since I do have 30-minute time slots, I do have more time to actually focus on the patient as well as ensuring that my charting is accurate. But I would say that there are sometimes when you have those complex patients or things that you just need to think about and think about your plan of care, then you actually spend more time, more of your free time actually devoted to making sure that that chart is correct and other people are able to see and understand what your plan of care is. So another con to being a nurse practitioner is actually the legal risk associated with taking care of patients. So as a bedside nurse, do you have to worry about legalities? Of course, everybody does. But I feel like as a nurse practitioner, it's a little bit more in depth because patients have the ability to actually sue you if they think that their care is not appropriate, if they feel like something negative is happening as a result of something that you prescribed or something that you planned during their care. So the legal risks are greater when you are a provider or a nurse practitioner. And also, even though you have your malpractice insurance, you still have to always be aware of those legal risks associated with treating your patients. So the third con I would say is actually the lack of understanding of your role by patients. So I have a lot of patients that they don't understand what nurse practitioners do exactly. So for instance, the older population, in my experience, they think that the medical assistant comes in and gets all their vital signs, and then the nurse practitioner comes in and goes over their history and develops this plan of care, and then a physician comes in after that and does the same thing. So it's difficult sometimes to actually explain to these patients that nurse practitioners are educated and fully capable of taking care of them as a whole. But on the other hand, you have those patients that actually appreciate the training that nurse practitioners get and the time and compassion that we have to spend with these patients and actually care for them holistically. So I would say the lack of understanding of the role of patients. And with that being said, sometimes nurse practitioners can be undervalued due to the lack of understanding of the role. Now, when I say undervalued, in my experience, some nurse practitioners aren't working to the full capacity of their license due to whether it's state limitations or facility limitations. So the undervalue comes where this nurse practitioner who has been trained to do these things is not allowed to do them because of whatever legalities or wherever they're working that doesn't allow them to do it. So that's where the undervalued can come from. The fourth con I would say is actually stress. So I used to work in a very busy practice, and we would see 20 to 25 patients in an 8-hour time period. And the stress comes along with, did you do everything you could for this patient? Did you do anything that could get you sued, or did you leave out anything that could be a legal factor? Is this patient going to come back? Is their plan of care appropriate? So the stress of actually all these factors of taking care of this patient at this higher role actually is a con of being a nurse practitioner. And talking about stress could actually be, taking care of these difficult, complex patients. For instance, that uncontrolled diabetic patient with an A1C of 14%, that doesn't follow up like they should, or there's a language barrier with this patient, or there's a socioeconomical barrier with this patient. So you have the stress of not only trying to take care of this patient medically, but you also have to take care of their social needs too, as far as, do they have transportations to their appointments? Do they have the money to afford their prescriptions? Do they understand their plan of care and what their role is in their plan of care? So that can be stressful when you're seeing these patients and you're not seeing any progress because of the barriers that they have in place. The final con of being a nurse practitioner is actually the education. So you spend 4 years getting your BSN, and then once you go to nurse practitioner school, that can be anywhere from 2 to 4 years, depending on if you want to do the master's route or if you want to do the doctoral route. So with me, with the doctoral route, I actually was very stressed in school. My husband was deployed. It was another 2 more years of school because I branched from MSN to DMP. It was 2 years of research. It was research along with working as a nurse practitioner. It was just a lot of stress of actually trying to get through the program. So education is a con in my opinion, but it can also be a pro. So physicians spend 4 years of undergrad, 4 years of medical school, and then however long their residency program is, depending on what they specialize in. But for nurse practitioners, we only do the 4 years of undergrad and 2 to 4 additional years of training, and that's it. There is no additional schooling that needs to be done to become certified as a family nurse practitioner. So I hope you found this video informative, and I hope someone out there gets something out of my nurse practitioner videos. Please like, comment, and subscribe, and thank you for watching.